You're listening to the Holistic Nootropics Podcast, your home for holistic, evidence-based cognitive enhancement strategies. And now your host, Eric Levi.
What is going on, everybody? Welcome back to another episode of the Holistic Nootropics Podcast, where we discuss using nootropics, biohacking, and nutrition to help you boost your cognition. My name's Eric. I'm the co-founder of holisticnootropics.com. And today on the podcast, I have Harsh Vathsangam. We got an awesome podcast to dive into with Harsh today. But before we do, just a couple housekeeping things. If you are new to the podcast, and please take a moment and remember to subscribe. If you enjoy the podcast, don't be stingy. Leave it a 5-star review over on Apple Podcasts. And if you're watching the video version of this, then remember to subscribe, hit that little bell icon, give it a thumbs up. And if you got any questions, comments, concerns along the way, leave those down in the comments below. Also, if you're a biohacker, if you're a nutrition junkie, and you're interested in finding the best quality supplements and nootropics on the market today, then head on over to holisticnootropics.com and download a copy of my free, yes, you heard right, that is free, Supplement Buyer's Guide. It is a fully comprehensive guide that will walk you through ingredient by ingredient on how to find the best quality supplements and nootropic products on the market today. Because let's face it, there is a lot of junk out there on the market. It is the supplement industry is $100 billion market industry. The United States has one of the worst medical outcomes of any country in the world. So you can probably tell there's a lot of junk out there. So make sure you don't sell yourself short. Don't sell your body, your temple short. Get the best quality supplements. You go download my free Supplement Buyer's Guide and you will avoid all the bad stuff and make sure you buy only the best, highest quality nootropics and supplements on the market today. And with all that out of the way, let's bring in our guest, Harsh Vathsangam, who is a PhD and the co-founder of the company Moving Analytics, a digital health company helping conquer heart disease and all kinds of causes of death and chronic disease out there. Harsh, welcome to the Holistic Nootropics Podcast.
Thank you so much. It's a privilege to be here and happy to have a very fun conversation.
I'm excited. We're going to talk about, we're going to take a little veer off the normal path of the podcast and talk about, some businessy stuff, which is cool, or at least the business side of the healthcare industry, like the actual application of healthcare itself. Because, as much as I like to talk about, biohacking and nutrition and supplementation and the body and all these things, there's this whole other side of it of like, how do we actually utilize healthcare in our lives? And of course, this is one of the hottest political topics you're going to find. I mean, it's something that literally affects everybody in the United States at the very least, and many people around the world. So I'm excited to have this conversation with you today. But before we jump into all that, I know you have a very interesting backstory, a wide-ranging set of cultures behind you. So you've seen the world. And I would love to know your story. How did you get into this world of healthcare?
Sure. Yeah. Interesting story about me is, I've lived and worked in 4 countries. I was born in India. And when I was very young, my parents moved me and my sister to the Middle East, where we grew up in this place called Doha, Qatar. And which is, for the soccer fans out there, the next World Cup location next year. And I came back to India to do my undergrad degree, and also lived and worked in Australia during that time period, and then came to the US for grad school, right? So when I joined grad school, I was actually interested in robotics, and I really want to do some fun thing in robotics and AI and things that are, kind of the hot topics today. What happened though was that somehow I think it was a combination of fate and also my interest was that I ended up working in this project that basically would take body-worn sensors on your body, and then it would sense physiological signals like how many calories you burn and so on. This is like before Fitbit, by the way, or before Garmin and all those things out there. And we actually use it a lot in helping people essentially manage their chronic conditions like diabetes and weight management and so on. It was just a thing where the more I got dragged into it, the more I liked it, the more I started working. So I worked a lot with the preventive medicine department there and so on. towards the end, essentially, I felt that it was probably going to be my mission to essentially help people lead and live healthier lives, and leverage technology to scalably deliver ways to help people lead healthier lives. And the company itself came from a chance meeting that I had with the American Heart Association, along with my two other co-founders, where essentially they said, "Hey, you're helping people exercise more, eat better. There's this application of this in the medical space called cardiac rehabilitation, which is basically a rehab program after someone has a heart attack or heart surgery to help them eat better, exercise better, and then not get a second heart attack." And so that was our first time we figured out what it was, but we just fell in love with the problem, and we've been working on that since as well.
Wow, that's amazing. And that's so cool that like the genesis of your company is from this very specific problem of brought to you by the American Heart Association, who recognizes that, hey, yeah, we're doing everything we can to prevent that first heart attack, but what we got another problem with are these second heart attacks. And you guys seem to have the answer for that. And as someone who's never had a heart attack, but definitely I've had members of my family have heart attacks. Obviously this is like one of the biggest killers, maybe the biggest killer of Americans. It's a problem that I don't think we've really figured out. And I'm trying to be on the front lines of helping people do that, but we're not getting through. It's a very complex problem.
Heart disease is the number one cause of death. It's higher than cancer, higher than some of the COVID-related deaths already, and it's the number one cost to the healthcare system, both in terms of direct costs, like procedures and everything you do, but also the indirect costs, which is things like people not being able to go to work, or they're not being able to lead self-independent, productive lives, and so on. The good news, though, if any, is that a large part of it is preventable if you can change day-to-day behavior. So something like 50 to 60% of it is preventable if you can change things like exercising regularly, or eating healthy, nutritious food, or, the right supplements, like you mentioned, and making sure you have your meds on time, making sure you quit smoking, and so on. So as well as I do, like, yes, everyone knows we have to exercise more or eat better, but then we often suffer with individual, environmental, or familial or social factors that prevent us from enjoying that healthy lifestyle as well. And I think what cardiac rehab does, and what our mission as a company in general is to really empower every individual to adopt those healthy behaviors, right? To act as a guide that can help individuals adopt those healthy behaviors and prevent future heart disease, prevent future heart attacks as well. And the way we do work in cardiac rehab is really preventing that second heart attack, because studies show that if you actually participate in cardiac rehab, your risk of a second heart attack is cut in half, and your risk of living another 5 years doubles. And who would not want that for themselves?
So how does your company Moving Analytics play into that? What specifically do you guys do?
So as I mentioned, cardiac rehab is a life-saving service, right? So, but having said that, 90% of patients don't do it because of issues related to access. And in particular, minorities, women just have a much lower than national average adherence rate. So I said 90%. For minorities and women, it is like 99%. Like most of them don't do it. And it's really this question of lifestyle in barriers, right? So you have to choose between attending work and attending cardiac rehab, or you have to drive like an hour-long distance. I live in LA, and you've got to worry about driving 1 hour to the hospital and then finding parking for another hour wherever you are. So all those kinds of environmental factors just make it really hard to attend. What we felt was that, hey, here's this like huge problem. It affects 3.5 million Americans every year. But 90 or 99% don't get access to this life-saving service. So how can we actually reimagine that service, or rather than the people wanting to get that service, we take the service to the people and try to meet them where they are and where it's convenient for them. And I think that's just a broader conversation we're having in healthcare in general, where rather than people going to a hospital, how can we bring the hospital or the medical services to the patient's home or the individual's home and make it convenient for them? And I think in today's world of Netflix and all the videos, Hulu and everything else, everything is delivered at home. Instacart delivers at home. Everything. Why can't your healthcare be delivered at home? And that was the sort of like almost the anger we had that drove us to come up with a solution like what we do over here.
So how do you guys execute that? Is this are these like Zoom calls with a specialist, or how does that happen?
So the way it works is if you qualify for our program, usually a doctor refers you in. We contact you, make sure you understand what the program's about, and then we ship you a kit. It's basically a box which consists of a weight scale, blood pressure cuff, wearable activity tracker, and sometimes we also ship you your own personal smartphone and so on. And we then connect you with a nurse or an exercise physiologist who's a medically qualified professional with background in cardiovascular care. That person gives you a full workup, right? Like, so essentially they'll figure out your clinical baselines, they'll understand where you are mentally. It's almost like your personal trainer who's working with you to really understand where you are at and what your goals are. They use that information to then create a customized plan for you, or the intensive portion of that it lasts 12 weeks, which consists of a combination of exercise, nutrition changes, education, counseling, and so on. And then over a period of 12 weeks, you basically have these just like Zoom calls or video calls where the care manager or coach works with you to really, they do a number of things. One is they're just there to listen. They're just they're there to listen to what you're going through, what is happening in your life, helping you navigate any barriers you're facing. So like patients have questions like, I had this medication and I felt anxiety. I don't know what to do about it. Those kinds of questions are there. They help you kind of think through and navigate through, or connect you to the right doctor to answer more deeper questions as well. And then if you're doing really well, they progress you. So they're like, hey, you're doing 30 minutes of walking every day. Let's bump that up to a higher heart rate. So you're more intense going forward, and so on. After 12 weeks, you still get to keep the kit, and you transition from an intensive model to a more self-maintenance model, where at this point you know what you need to do, and where it's all about enhancing and making it permanent for the rest of your life. And your coach is available to you during that time period for any kind of text-based questions you may have, and so on as well. So that's the idea behind the program. Yeah.
Wow. Yeah. This whole kind of telehealth revolution that's happening right now, I guess you could say it is really probably the best silver lining of COVID, to know that not like it's possible to go see a doctor without leaving your home, or a specialist or a trainer or a nutritionist or whatever it is. And you're right. For a lot of people, the barrier to getting these services is just simply getting in the car and going, because you're right. Like in a place like LA, who has an hour plus, depending on the day, to sit in traffic, right? And this is all over the country, sitting in traffic to get to an appointment, taking time off of work, taking time away from your family. Now people are seeing doctors not even in their home city. People are seeing doctors that they've heard on podcasts or have popular YouTube channel who they know they connect with. They go, I like this person's style. I like this functional doctor's approach to medicine. I like this whatever it is. You can see that person now. You can be in Florida and see a doctor in Washington State, right? And so this is such a cool innovation that is just, sure, of course, we still need to go see the doctor in person. Of course, there's certainly that way of doing things, but most of the doctor's appointments out there, you don't need that. Most of the doctor's appointments out there are just like, okay, let's check your vitals. you're sending them the box to check those vitals along with these trackers. And of course, that's a whole thing in itself with the technology to be using wearables to track people's heart rate and, all those different metrics they check for, cardiovascular issues. So this is definitely groundbreaking stuff.
Yeah, thank you for those kind words. And I think you're right in that a doctor's brand and reach now is not just their neighborhood or their zip code. It's the entire country, right? And then the implication you have is, how does that, when you can get access to the best doctor anywhere, how does that affect how doctors treat their patients, right? Like in terms of, just the scalability of of the 24 hours in the day they have, and then on the patient side, how does that affect how they reach find and search for their doctors? And in today's world, it's very transparent which doctor is doing a good job and who's not, and so on. And I think that I think overall it's very good for the healthcare system that you're promoting this fluidity in getting access to the best care, regardless of geography or location as well. I don't think that it's going to be completely 100% virtual. I know there's talk of like the metaverse and everything nowadays, but like I do think there is a place for in-person care and just like face-to-face care, most likely around more intense indications or conditions that you may have. But it doesn't have to be in-person first. I think it can be a virtual first and then taking you into in-person care as and when you need it as well. Yeah.
I think you're right about that. I think there's, it's all changing right before our eyes, man, because again, I wasn't even saying this at the beginning to reference it back in the podcast, but the fact that when you look at the chronic disease numbers in the United States and just how, broken the system is, when you spend, exponentially more than even the second, the second ranked country in the world of how much they spend in healthcare. Like I don't know who's second to us. Maybe it's Canada, maybe it's Japan or a country in Europe or whatever. We blow away other countries as far as how much we spend on healthcare. And the fact that when you have to go down, what are we, like the 30th, 40th, 50th ranked country as far as like how healthy our population is. I think the most recent stat I saw was 42% of Americans are obese, not even overweight, obese, one in 5 adults has type 2 diabetes, 1 in 20 kids has type 2 diabetes, and it's only getting worse, right? Because the younger the kids now have the adult onset diabetes, the kids have the autoimmune issues. They have, allergies up the wazoo. And the fact is like, we don't have the waiting rooms to keep all these people who need to see the doctor. And then you start putting COVID on top of it. And then you start putting all of the stuff that didn't happen because we had to make room for COVID. And now you're just looking at like, medical waiting room, just disasters.
Yeah. I think healthcare, someone once told me that, this is a public health person told me that it's not entirely accurate to say that bad health or chronic diseases are unprofitable, because there are entire industries that are built around sitting. So there's like, you sit in a car and you drive to work. You sit in a movie theater, or at least pre-COVID, you sit in movie theaters. You sit in a restaurant, and so on. So there's that whole industry that's built around just having people sit for long hours. Like Netflix binge watching is just long sitting for hours, right? So I think that as a society, we'll probably have to just take a call and say, look, we are going to purposely design our lives around healthy options, right? And that means it's not just changing your hospital or doctor. It's also like designing your neighborhoods in a way that it encourages walking and it's safe and okay to walk, or the ability to take public transport more and so on, so that you have access to care without needing to take a car out and so on. And then there's a lot of education and counseling and just environmental factors that I think, particularly with COVID, have come to the fore, because there are a lot of people, they're working at home. They don't necessarily have all the social interactions they used to have. That can cause potential mental health issues, which can then result in them not exercising enough because they're not in a good state mentally and so on. So I think there's just like this whole systemic thing that as a society we have to commit to, and then bring out like education campaigns and so on that can help support a lot of these efforts. It's not a one-day fix. I think a generational fix will have to do as well.
Generational fix is probably the best way I've heard somebody describe what's needed in this system, because there is no politician, there is no policy, there is no bill that can possibly get passed that's going to just transform the medical system. They tried to do that 10, 11 years ago when they passed the Affordable Care Act. That just made things worse. The fundamental generational change, I think it's being seen already. Like I come from this background of like biohacking and health optimization, holistic health. That's where my focus is. And at the end of the day, all holistic health is just preventative health. And it's the real preventative health. Like they say, oh, go get a mammogram. That's preventative health. Or, go get your, for a guy, go get your prostate checked or whatever. And those things are absolutely necessary. But real preventative health is like transforming your diet, getting away from fried, foods, having a more active lifestyle, even if your job requires you to be at a desk for 60 hours a week. Like there are those moments where you can get up and walk. People have pull-up bars in their homes, like the home health equipment industry. I mean, just exploded during COVID. Actually, it was impossible to find a kettlebell to buy. Believe me, because I know I was looking for them. So people are now like, I think, coming to grips with this idea. I think about this a lot too, where it's like, I feel like you have more health conscious people now than ever before, where like, when did you ever have a time where there were so many gyms around, and just your everyday people are just getting workouts in, I don't know if like in the 70s or the 80s, people just like went to the gym as much, or like really geeked out on, on health information. So I think we're turning the ship around, but there's a long way to go.
Yeah. And, I think the, one thing I've realized, and it's just only accelerated exponentially, has been the availability of information to help you manage your health, right? I'm a huge tennis aficionado. I don't think my tennis game has improved as fast as it did during COVID, basically, just because I would find all these like videos and they'll talk about different techniques, and I'll just go practice them, and they're just so like thousands or tens of thousands of them. I think that's a blessing, but also a curse in a way, because now you need to find the curation of those content to make sure you're not, like over exercising and then get injured or eating the wrong foods that didn't match your body type and so on. And I think that's where I think the expert plays a role, which is in curation, right? I think the trend of working out at home or working out in your neighborhood gym is here to stay. And I don't think it's like an ebb and flow kind of thing where, 10 years later, they're not going to do it. There's so much more awareness, like you said, and there's so much more content out there. I think the role of experts or, sources of information is really just curating that content to personalize it to your lifestyle and your particular needs, your body type, your family dynamics, all of that stuff. And I think that's where I see more innovation happening as well there.
Yeah, and I think I feel like the structure of the healthcare system has to fundamentally change, where we stop looking at like family medical doctors as the source of who we get our health information from. Okay. Yeah. Very unpopular opinion. I know, because people hold these doctors on pedestals, but the fact is a lot of medical school students just aren't coming out as general practitioners, because there's no money in it anymore. You gotta be a surgeon, you gotta be a specialist, you gotta do something specific and you don't want to work that much, right? You don't want to work like, where is the reward in having to be the guy or the woman who is the front line when all of the patients are just like, there's something wrong with me, I don't know what it is, and you have to have this entire like encyclopedia of knowledge to be like, oh, it's this thing, and then here's the answer. There's just a lot of versus being a guy or a person whose my specialty is cardiovascular. My specialty is I'm an endocrinologist. My specialty is skin. My specialty, whatever, right? My specialty is ear, nose, and throat, right? Yeah. So what's happening is we're losing like your general practitioner family doctors, or you're going to them and they're just overwhelmed to the point where now it's that kind of cliche visit of you're in there for 6 minutes and they have to do a full workup on you. And then this is where you get overprescription of antibiotics, overprescription of, antidepressants, opioid, like cholesterol medication, blood sugar, blood pressure medication. All these different medications are totally overprescribed because, quite frankly, these general practitioners, they just don't have the time to see patients. They also don't have time to keep up with the research. Like, it's a lot to ask of one person to say, hey, I need you to see, 20 people a day. I need you to work 10 hours a day, 12 hours a day, be the first person that these people see, the first person who they're going to complain to, on top of staying on top of all of the research and all of the information that's out there. Of course, you're going to get your data from, some like frosted tip pharmaceutical representative who's coming and telling you that you're going to make more money by pushing their drug. Like, they're going to tell you, give you their funded studies. They're going to give you their information on their drug. And what are you going to say? No, like, you don't have time to read the full PubMed study. It takes forever to read those things. So I think what's happening now is we have to have a shift. We have to have a shift where people know, like, you have to do the work yourself. You can't count on your GP. And then this is where I see the role of health coaches come in, because you see this explosion of health coaches. And I do health coaching. It's not my full time, but I do it. And there are some very good health coaches out there. There's health coaches who used to be like dietitians, or they have dietitian backgrounds. But in fact, I actually think more that this is where, and I know I'm loading you up with a lot of stuff right now. I don't mean to ramble, but it's just kind of my thought going through where, we need to integrate like naturopathic doctors, right? Because naturopathic doctors, DOs, these different kinds of doctors, even chiropractors, I feel like these are the people that should actually be the front lines. Like, you should be seeing a health coach first. If you're like in this kind of like preventative health maintenance thing, if you have an emergency, then go to the doctor. But if you're just dealing with chronic, like low level stuff, which most of the people that are filling up these doctor's office waiting rooms are, you should be seeing a health coach who can spend 30 minutes to an hour with you, give you nutrition plans, give you activity, kind of like what you're doing, get you using wearables and trackers and teach you how to, track nutrition and track things going in and out of your body. And then when you have an emergency, and then when something pops up, when you get sick, then you go to the medical doctor. You're doing your checkup with the health coach, you're going to the medical doctor, because, I see this dystopian future where, and I feel like we're getting really close to where, healthcare is just skyrocketing through the roof. Now you got COVID. Now you got all these compounding factors. Nobody's paying for pre-existing conditions, where we're going to get to a point where it's going to be all through AI, and we're just going to end up going to kiosks, and that's going to be your doctor. There's just going to set kiosks up in what used to be doctor's offices, and you can see 3 people at a time, 5 minutes at a clip. Just, it'll be like a fingerprint or a hand or some way for them to be able to take your vitals and go, here's your pill, bam, and you get the pill. And of course, when the dust settles through all of this, the only one standing, unfortunately, is going to be the pharmaceutical companies, because they're the ones who can afford to make their way through all this mess. So that's my soapbox. That's my rant. Hopefully we didn't lose anybody through that, but it's just, this is like what I'm thinking about as I'm seeing, I've been seeing this catastrophe with healthcare coming for a while. But now I see it actually happening during COVID. And I just don't know. I don't know how it's sustainable in any way.
I think a couple of points really struck me from your statements, which is we just don't have enough doctors, and the doctors that are there don't have enough time in the day, and and it's not a problem that's going to be solved, I think, forever. Like, I don't think you'll ever be able to get enough doctors to help 350 million Americans every year. Even if you had one for every 1,000, you're looking at 350,000 doctors. That's not happening at all. That kind of tells me that you need to rely on, for lack of a better word, like a quote unquote lower skilled force or lower degreed force, but you need to empower them with the right resources, the right training, and the right quality control systems to basically make sure that they're practicing at the top of their medical license. And everything they say is evidence-based, but also at the same time, they're also being very personal in their care with you, right? So, and they're almost like almost like a friend, philosopher, or guide for you, or a navigator for you through the healthcare system.
Mm-hmm.
And they actually start working with you before you get sick, right? Like, and by virtue of doing that, they know you sometimes better than you know yourself. So I think that there's just like that opportunity that, which is where healthcare should be heading in that to help plug the gaps in care. And I think where technology can really play a role there is in parsing large amounts of information and summarizing it in a way that's useful, both for you as a consumer, as a patient, but also for the practitioners, the so-called lower level practitioners who are working with you to get you the right care as part of it, right? So why can't we use AI and NLP to go through all those PubMed articles and then summarize the results in a way that's super easy to consume for the individual person, like with someone with a 5th grade degree of English proficiency or classroom education, right? So that's one thing. I think another important side to that is, recovery or care is not just about like pills or interventions. It's about your emotional journey too. Like, a lot of patients go through a lot of traumatic events as part of their, just simple thing. Like, if I found out I have cancer, it would be such a immense journey for me personally to just even process that information, right? So, and I think where these second order practitioners could really help is helping people make sense of their condition and just walking them through, like, not even, I would say, giving the treatment, but just helping them understand, explain to them what they're going through, and have them take the call as based on an informed decision as well. And that's kind of the thesis behind how our company is built. We just felt that there's this like huge gap in care with respect to helping people navigate the healthcare system, but also catching them and being their guide from a behavioral standpoint or emotional standpoint as part of their recovery journey, as part of their treatment journey, or if they're not sick, as part of their health journey in general. And I think, to your point, I think to me, that's the bigger opportunity in healthcare today, really being that person who can really work with you and the constraints of the system around you to create something that really makes sense for you to get healthier and also become quote unquote a better version of yourself, right? Like, as part of it. So some really good points in there in what you said, for sure.
And with you guys specifically, it sounds like you guys work with health insurance, I would imagine, because that seems to be, like, as a health coach, the biggest barrier to people working with me is they want to, and they go, I like your message and I feel like you could help me, but I really only do my healthcare through my insurance. And unfortunately, most people are kind of like stuck in that paradigm where it's like, I go to this doctor, he's not great, but he's in my network. And if I don't go to him, then I'm on the hook for it. And this stuff starts to get expensive. Yeah.
I think the health insurance, well, let me put it this way. It's necessary, but I think it can improve a lot in terms of providing access to care. For better or for worse, and it's true in most other countries, people don't directly pay for their healthcare for the most part, right? Like so a lot of what influences people's decisions is just what is already paid for through their quote unquote membership, right, in the health plan that they have as part of it. And I think the implication for me is that I think, and health plans are recognizing it too, and they're really trying to make several initiatives around this, which is really focusing on that social determinant of health and covering benefits that can really affect positively a person's social determinant of health. It was interesting. I was in this talk earlier, and a health plan is trying to figure out what influences cost. What is the biggest correlate of cost of care for a patient and readmissions and so on. And they checked all kinds of things. So they checked their income levels, their previous medical history, what diagnosis they had, and they found that the single biggest correlate was your zip code, basically. And literally where you live determines whether you live till 85 or 65. Like that's like a mind-blowing kind of thing. And that was, and then the question is, why is it like that? And I think that really goes down to like, what is the environment around you like? Do you have access to good food, or are you just getting like junk food nearby, or whatever fast food chains are nearby? Or are you living in a safe neighborhood, or in a neighborhood where there's a lot of gun violence, for example? So, and then health plans are starting to sort of figure out how they can be a part of that conversation and part of those communities to reduce it. Because I mean, not obviously from a altruistic standpoint, it helps their members stay healthier, helps their members stay emotionally well. But from a kind of hard-nosed financial standpoint, it's lower cost for them, and they're starting to realize that as well. And they're starting to invest in these preventive approaches. But I think that's where we are trying to position ourselves as a company to carry that message forward, to basically say, it's great that you guys are doing this. Here are more ideas that you can do to essentially get that behavioral aspect of care forward, because that's where a lot of the cost savings are for you as a plan, and individuals will benefit from that as well.
And can you give some examples of what you're actually doing, or what you see some of these health plans doing to help that? Because like you go through some parts of the country, man, and it's like the food desert thing is real, like there's a lot of towns in America. Probably majority of cities and towns in America are just, the people get their groceries from like a teeny little convenience store, so they're not getting fresh fruits and vegetables, or they're not getting good quality, and or there's no gyms anywhere, and it's not even safe to even go out for a walk. So I'm curious, like, what you see health plans doing, or what your company's doing to actually help create better conditions like this.
So from the health plan perspective, a few things we've seen. So I'm sure you've seen, like for example, in the South, the food is very rich in salt. And when you have a high amount of salt, leads to higher blood pressure. That leads to all kinds of complications. And so some of the things we've seen health plans do is they basically provide free meals delivered directly to your doorstep, which are low salt content, and are also nutritionally sound in other ways too. Like they have the adequate amount of protein, the adequate amount of vegetables, and so on and so forth. And they do this for members, for example, in their Medicaid populations, where access to food, or like food deserts, are a real thing. So that's an example where care is being delivered to the home. It's helping you address one gap in care, which is access to good food and healthy food that can potentially extend your lifespan. And also it's catering to populations by zip code, depending on who they are, and it's kind of strategically targeting them. I would say other types of things specific to movie analytics. One example of thing that we've done is we just made our whole app and our whole technology experience available in Spanish, right? So, and you have specific content that is catered towards Spanish-speaking populations, native Spanish speakers. That is, even the foods that we talk about are different. The social dynamics and social things that we talk about are also different. And we're just creating that custom content that makes the most sense for that population. And we want to extend it to other ethnic groups and so on as well. So I think those are things that where, for example, like you're trying to meet them where they are and not have them essentially learn a new culture or learn or take extra effort to get the access to care as well. It's part of it.
Yeah, no, I think that's, I've never heard of the delivering the food to people thing, but that's, if that's going on, I mean, that's certainly a step in the right direction. You know, and then what is, as far as you've seen, the mental health aspect or hurdles that you see coming from, you know, post cardiovascular events or some of the things that you guys work with specifically?
So, you know, when you have a heart attack, it's literally a time of 30 seconds could have made the difference between life and death for you. You know, if you'd come in 30 seconds later to the hospital, your heart might have given up and you would, you know, be dead. And for a lot of patients that, you know, the act of identifying they had a heart attack, getting checked into the hospital, and then, you know, they're unconscious for a day and then they're awake again somehow miraculously. It's a very, very eye-opening event. And it's also a very traumatic event because, you know, now all of a sudden you feel really vulnerable because you thought you were doing okay, but then you almost died because, you know, there was a blockage in your artery or something like that. And then you have all kinds of questions in your head, like, you know, is it safe for me to even walk now? Is it, how long can I do this? We've had questions like, can I have sex with my spouse, for example? You know, like these are all things that very deep personal questions, but you don't know what they are, and in addition, in some cases, because you've literally had your chest open, you know, you could fall into depression, you could fall into this anxiety attacks and so on, because it's just a confusing time. And you're also bombarded with a tremendous amount of information there, right? Like when you're in the bed, you just imagine you have all these wires plugged into you, you're on meds, so you're kind of conscious, but not really. And the people are giving you a sheet every 5 minutes and you have to bombard all the information. It's really tough to just parse through all of that and just understand what's important, what's not. And you may not even remember all the instructions. So I think what we've realized is really the value we provide as a service, and I'm sure other services do the same thing for other indications, is really being that navigator in your journey, connecting you to that experienced medical resource like we discussed earlier, who can then say, let's take this step by step, and I can help you prioritize the things that make the most sense from a medical perspective and which matter to you as well. And then just help you recover, from that initial point of vulnerability all the way to 1 year out, 2 years out, if need be, right? And take you to a place where you probably are even in better health than you were before the heart attack. And that's something that a lot of patients have said. I didn't realize that I could actually get even healthier than I was before, even though I had this traumatic event in my life. And I think what's key there is, because they had that traumatic event, they're willing to do anything to change their lives at that moment. And that's a really good point to tap into their psyche to bring about positive behavior change. Unfortunately, I hope that that's not what it takes for the rest of the country who didn't have heart attacks to change their behaviors. I hope we can get a lot better. But for those who do have it, that is something that's actually an interesting starting point for a new point in their lives as well.
And going forward with moving analytics, are you guys solely focused on cardiovascular patients, or do you see yourself branching off to help treat other people with other conditions like autoimmunity or cancer or whatever it is? Because it sounds like the treatment is spot on, and it sounds like something that really, if you're doing cardiovascular rehab, I understand that's specific, but if you're sending things like wearable tracking devices and meeting one-on-one with specialists, I feel like this can definitely be applied into any kind of preventative health protocol.
Yeah, I think our vision is that this is almost like a digital pill we're prescribing you, to use pharma terminology, right? So, but it's a pill which is designed to get you to adopt healthy behaviors to lower your risk of future disease. And as I mentioned earlier, there are specific reasons why we picked after heart attack, which is, it's a really good point for behavior change. But really, this paradigm can be extended to any setting where you want to change behaviors to reduce your risk of future disease in general. So you're spot on in that, it could also include people who are looking at weight loss to reduce their hypertension, or people who have high blood pressure, or people who have some like post-cancer recovery, for example, and where cardiovascular health is super important. So all of that, I think, is there's also mounting evidence that this behavior change paradigm actually really works. And that's where I really see the vision for us in terms of expanding both within the US, but also nationally. And I think if not us, there'll be many more companies that'll come up in the space in the future too.
That's great. That's awesome. Yeah, this is so cool to have a conversation with you and talk about this topic that it's so relevant, and it's just really where I hope to see the industry go. I used to work for a medical equipment company, and I worked with insurances, and man, this was 15 years ago, and it was a disaster then. And it can only be even more of a disaster now. Because it's like you said, like nowadays we shouldn't have to go to see a doctor. We should be able to do this all from home. And, if again, the pandemic taught us anything, if you figured out how to work from home, and just think about how much better your life was like when you didn't have to commute and, bring a lunch with you or go out to lunch every day, which is, again, another contributor to chronic disease, right? Eating out all the time because you don't have your kitchen with you. You could sleep a little longer. Immeasurable health benefits from that. You get to see your kids more. Immeasurable health benefits from that. So why can't we do this with the medical system? Why can't we do this with these things just to keep people out of doctors' waiting rooms? So when you do have that emergency, you go, and it's not such a log jam. It's really cool to see your company, on the forefront, making this accessible to people. So that's really cool.
Yeah, and I think this is just part of a larger movement. And I think one of the things that I hope more people take from this conversation is just that there's just so many opportunities, not just in cardiovascular care, but in other conditions as well. Both in terms of leveraging the power of human touch, which is not doctors, but also in terms of leveraging technology to scale people further. So where one person can now manage or to help serve thousands instead of hundreds of people. And I think those are all interesting themes that we'll see more of in the coming years as well.
Yeah, couldn't agree more, my man. Harsh, this has been a really fun conversation. I've certainly learned a lot. I'm sure anybody listening or watching would probably agree. If somebody was curious about learning more about Moving Analytics, how to work with your company, if they had any questions, where would you send them online?
Definitely go to our website, www.movinganalytics.com, or send us an email, hello@movinganalytics.com, or reach out to us on Twitter @movinganalytics. We're here for you and happy to answer your questions.
Fantastic. And we will link to all of that in the show notes and the podcast description when this is all released. Harsh, thanks again for joining me today on the Holistic Nootropics podcast. Listener, viewer, to learn more, head on over to movinganalytics.com, find Harsh on Twitter. And to learn more about Holistic Nootropics, head on over to holisticnootropics.com, or just spend some time, take a gander, forget about your obligations, your children, your homework, your work things. Spend some time over at the Holistic Nootropics YouTube page and get all caught up on what we're doing here. Otherwise, we will catch you on the next one. Peace.
Thanks for listening. For more brain-boosting info, in-depth articles, and show notes, check out holisticnootropics.com.